Welcome to the introduction on how to conduct a counseling session for Year 3 Semester 2 students. This can also be used by any other students who wants to learn about the basics of counseling. This is Dr. Fawaz from Department of Pediatric Dentistry, and I'm here to talk to you about how to conduct a counseling session. So in this particular posting, when you are in the second posting in Year 3 Semester 2, you are required to learn how to do counseling session for parents for 4 different topics, right? And one of those topics are on the importance of primary tooth, on how to break a bottle feeding habit, and on oral habits, and one more is on diet, right? So you will be engaging parents and discussing with them these 4 topics. So let's begin on the counseling. So basically, counseling session is where you sit with the parent in a private space with no disturbance, and you engage them in conversation. And at the end of the counseling session, the parents should walk out with a positive feeling that they have the power to change their behavior or their child's behavior towards a particular thing. Okay, so when you are doing the counseling session, you have to ensure that first and the foremost you need to speak privately with the parent in a consultation room kind of a setting where you have no disturbances, so you engage with the parents one on one. In order to have a successful counseling session, it is very important that you follow the steps that is shown on your screen in those particular orders. So if you miss one of these steps, your counseling session is likely to fail, and you will not be achieving any behavioral changes from the parent or the child. So essentially, we are performing this counseling session with the parents in order to have a behavior change in them so that they take positive steps towards creating a better environment for their children's dental health. Okay, so the first and foremost thing in counseling process is to establish a good rapport with the parent, right? So you have to do this in all counseling sessions. So you have to smile a lot, you have to show empathy towards the parents, you have to have a very good listening ear to the parents, and you need to make friends with the parents. Okay, now the parents will not take any advice from a stranger, so you have to break that ice between you and the parents, and you really need to show them that you care for their child's dental health and you care for them, and they must take positive steps. So unless you establish a good rapport, the parents will not heed to any of your advice. So once you have this ice breaking session with the parents where you introduce yourself and you present yourself very professionally, smiling and caring with empathy, you go on. Next step is to assess the problem that the parent is having, right? The parent can be having a problem of, say, he's unaware of the importance of primary teeth, right? So you need to assess the length and the breadth and the depth of the problem. So you need to have a good communication skills here. So you have to ask the right kind of the questions to understand where the problem lies. And once you understand where the problem lies, then you need to go to the third step in the counseling session, that is the set goals to achieve. Now, unless and until you set goals to achieve, there will not be any behavioral changes, right? So don't leave the counseling session midway thinking that you have given some recommendations, you have given some advice to the parent and the parent will take it. No, the goal setting has to be there. You have to set goals for the parents to achieve, and don't set very high goals, set very small goals. So once people achieve the small goals, they get motivated to achieve higher goals. So set some goals for them to achieve till the next review session that you have with them, right? And make sure these goals are small and achievable. And once you have set the goals with the parents and the parent understands that what they need to do, you have to offer some suggestions for change. Okay, so you have to give them some doable advices, some doable recommendations, something that they can do, something that they can begin their behavior change with, right? So don't give them a very open kind of a suggestion which they feel lost from where to start. Okay, so you have to give them small doable suggestions, recommendations and advices. So the parent should feel that, okay, I can do this, I can do this. And then you have to uh, see to it that the patient achieves the goals that you set for them, and that would be your last step in the counseling process, which is the periodic evaluation. So when the parent comes back after period for review, and you ask the parent how they have been and how have they achieved their goals, what are the barriers they had in achieving the goals that was set for them in the last counseling session. And from this you evaluate, the problems that they faced in achieving the goals, the barriers they faced, the difficulties that they faced. And then you again go back and give them new advices how to overcome the barrier, and how to overcome their problems and what they can do, and give them some positive advices. And this will go on till the patient achieves a change in behavior, or it may happen that patient may not achieve a change in behavior at all. So we're going to look at that problem a little later. But from this slide, I would want you to take home the message that you need to perform these 5 steps to have a successful counseling. Okay. Next we come to the counseling skills, right? So unless and until you have these skills, or you develop these skills, or you kind of have some level of mastery in the skills, counseling sessions will not go well. Okay. So basically you need to have two kind of skills here. One is the communication skills, and of course the other is your clinical competency skills. So in your communication skills, like we discussed, first and foremost you should have a good questioning and interviewing skills. So what it means is that you need to ask the appropriate questions of what, how, when, where, how did things happen, to understand the length and the breadth of, and the depth of the problem that the parent is facing. So you need to have good questioning skills and good interviewing skills. And these skills can only come when you have the good listening skills, right? So you have to give a really empathetic ear to the parent's problem, right? Some parents may not open up with their problems because, first time visit, they may still feel that you are a stranger and they may not open up to you. So don't worry about that. You give them a listening ear, right? So they will feel less burdened that somebody has heard their problems, and maybe they will open up. And once they open up, you may have some confronting statements from them, right? For example, a child who's got all his primary teeth in a very very bad carious severity, and they will say something like, I brush my child's teeth 3 times a day. All right, and which is literally contradictory to what is seen clinically. So you have to have these confrontating skills, so that you understand, that the patient is lying about the particular statement. But then it is okay, because when you sit with the parent in kind of a counseling situation, the parent is normally feeling, or he's blaming himself for putting his child in this condition, where the condition has gone out of the control and the doctors are doing so much, and now the doctor is going to sit with me and he's going to tell me the problem with my child and things I should have done which I have not done. So they normally come on the back foot, and they try to blame themselves, and then they will give you confronting statements. So it's okay, right? So once you hear this confronting statement, don't confront them with another question and another question and bring them to the truth. You have to understand that part, that this is how they are feeling, so you need not probe further into it, and then you have to stop. So you need to have a very good listening skills to understand when this is happening. And of course, when you have all the information from the parents, you need to have a good analytical and problem solving skills. This is a bit tricky part, because most of us are geared for giving information what we read from the book, right? So when we are faced with some information which is not from the book, we find ourselves lost. So we need to have a good analytical and problem solving skills. So with these skills, any problem that you are faced, you can use your common sense, you can use your knowledge from what you have read in the textbook. You're going to modify it and turn it around, upside down, left side up, and then you want to come to an analysis where your brain will tell you, okay, this is where the problem lies, and this is what we should do about it. So you will certainly find during counseling you will be giving some unorthodox advices, right? And which seems to work, so it's okay. It just basically says that you have got a good analytical skills and a good problem solving skills. So you need to think out of the box when you are counseling patients, regarding their problems. So don't stick to the textbooks. If it's not there in the textbook, you cannot say it's not like that. All right. So you need to think out of the box and have a good problem solving skills. And the last is your understanding and empathy skills. All right. So no point sitting there like a big boss, right, instructing the parents, you should do this, you should do this, you should have done this, why did you not do this, this is taught in school, where you're not aware, this thing is all over the place, why are you not doing it, you must do this, you should do this. No, 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 no. All this is not to be done in the counseling session. In the counseling session, you are not an authority figure. In the counseling sessions, you are partner to the parents problem, right? So you, like a good partner, you listen to the problem and then you give good advices for the parents to act on them. So you really need to have a very good understanding, you need to be very patient, and you need to have a good empathetic skills. Don't try to rush through these counseling sessions as you want to finish the counseling session and go to the next patients. No, whatever you say or speak with the parents may have a life changing experience for the parent, right? Suddenly the parent will realize that, oh my god, this dentist is so nice and he's spent some 15-20 minutes with me trying to understand my problem and he's given me some solution. Let me try that problem, let me try that solution. And suddenly you find that you begin to have a very good rapport with the patient, and the patient begins to trust you and he opens up with you and he discusses you further, and then you get to bottom of the things and then you get the things done correctly. So you need to have a very good understanding and empathy skills, right? So you cannot be stubborn, you cannot be authoritative during the counseling session. You need to partner with the parents problem. And of course the last one is the clinical competency. You cannot bluff your way through this counseling sessions, right? So if you don't know anything that the patient is talking about, okay, it is very very reasonable to tell the parent that I am not really clear about this particular problem, why don't I get back to you with this problem when you get back in my next session. Till the time maybe you can try this. So it's okay to admit that you don't know something and you have to go back, and when the patient comes to the next appointment you need to clarify what was left undone in the previous counseling session. So it's okay, nobody's perfect. So if you don't know anything, admit it, you don't know anything, go back, read and come back, right? So this way the parent starts trusting you even more. So he knows that the doctor is honest, he didn't know, he went back and he got information from me and now he's giving me the information. So the trust kind of develops further, that this doctor will not lie to me, right? And this is very important in the counseling session, that the parent trusts you, right? So this is a very good trust building, that you admit that you don't know anything. Of course, you're not God, so you will not know anything. No, you will not know everything, right? So keep calm. If you don't know anything, just say, I'm not very sure about this, and let me get back to you. So it's absolutely fine. It happens to me so many times, right? So instead of bluffing your way or lying your way through anything, it's better to accept that you don't know, and then you get the correct information for the person. Okay, so now every parent has to have a behavior change, right? So whether it is regarding giving non-carcinogenic, making changes in the diet for the child, or trying to break a bottle feeding habit for the child, or trying to break a oral habit for the child. So there has to be a behavior change either in the parent or in the child. So, and this behavior change never occurs overnight. It takes its own sweet time, right? So you cannot rush through behavior change. So there is this theory called as TTM, Trans Theoretical Model, and this theory tries to explain how the behavior changes, right? And there are 5 stages in this theory, and you can find your particular parent in any of these stages, and then you need to counsel them. So stage 1 is when the parent is not ready for the change. Okay, there are some circumstances the parent is facing and they are simply not ready for the change. So your duty is not to give up, right? Your duty is to be persistent with the counseling session, right? Be persistent with your information at each counseling session. So you need to continue the counseling session. So if your counseling session starts working, which may take like 12 months, okay, the parent will go into the next stage, that is getting ready for the change. So when the parent has enough information and they realize the depth of the problem, they will get ready for the change. And the third step would be they are ready for the change. That means they are now going to take positive steps to bring a change in their behavior. Okay, so those who reach this step, from here it's very easy to take them to the next step, which is next stage, which is the taking of action. Right, so the parent is equipped with all the knowledge, all the information, all the good advices that you have given them, and then you give them one final push, and they take the change in their lifestyle. For example, introducing vegetables for the children in their diet. Okay, so they start doing it, they start taking the change, they start uh, changing their lifestyle so the child's diet can improve. So this is the stage 4 where they start taking the actions. And then in the stage 5 is when they maintain the change that they see. So once they introduce, say for example, vegetables to the child who does not like, and they persist in stage 4, they persistently try to introduce the vegetable to the child, and there will be a time when the child starts eating the vegetable. And the day the child starts eating the vegetable, they have to maintain this change in that for the rest of the child's life. So this is the maintaining phase. What you need to understand here is that at each stage the parent will have something called as the decisional balance. Okay, so at each stage the parent is gonna do weigh cons and pros for the particular advice that you give, right? And if the advice, the pros are good, they will go to the next stage. If the cons are good, they will stay in that stage, or maybe they will recede back into the earlier stage. So at each stage there is this decisional balance. So what I'm trying to tell you here is that you don't get frustrated or feel unsuccessful if your counseling is not working, right? So don't blame yourself that you're not good enough, that your counseling is not working. No, don't do that, because the patient, the parent will be in one of these stages. Okay, and you need to be persistent with your counseling session. So you need to appoint, keep giving them time for the counseling, right? There may be a time when the parent themselves will stop coming for the counseling session, and then you understand that the parent is still in the stage 1 and they are not ready for the change, and you cannot do anything about it. You have played your part, and the parent has taken a decision, and you can terminate your counseling session there. So don't worry if your counseling session doesn't work. You need to be persistent to bring a positive change. Behavior change does not take place overnight. Like, Rome was not built in a day. So these kind of things will happen, so don't worry about it. To conclude, I want you all to remember that the basic process of the counseling session, the skills that you need, and the stages of behavior changes that are there. And hopefully we apply this structure to all the 4 counseling sessions, and we will come to a place where all your sessions are very structured, and you know the steps that you need to do and you need to follow. And you will be very surprised that once you are very systematic in your approach, hopefully there will be a good or a prompt response from the parents, and they appreciate your time that you are given to them. Okay, so with this I end this presentation, and in the next presentation we're going to start and have a look at how to do a counseling session for a parent who has got a child who's got a bottle feeding habit, or any of the others that we have. All right, so you take care, and I'll see you next time.